Hello and welcome to Medical Edge. My name is Todd Barnes. This program is produced as a partnership between the Mayo Clinic and the City of Thornton. We hope every episode provides you with valuable health information for you and your family.
I always say that even on my good days, most people would have called in sick if they felt the way I feel on good days.
When Caroline Gort was diagnosed with lupus more than a decade ago at the age of 30, she remembers struggling with the word incurable.
Our brains are hardwired to assume that if you get sick, you get better.
No two cases of lupus are the same. Any tissue or organ in the body can be affected: skin, heart, brain, kidneys. Caroline says for her, life is a daily battle with extreme exhaustion and severe joint pain, all because her misguided inner defense system is attacking her own cells.
So the job of our immune system is to fight bugs or cancers. And in lupus, the immune system cannot distinguish the self tissues from infections or bugs or other things.
Mayo Clinic rheumatologist Bai Chowdhury says the cause is unknown, but seems to involve a combination of genetics and the environment. And women are 9 times more likely to develop lupus than men.
Hormones, female hormones, can also increase the risk. In fact, a lot of people recall having their lupus start after pregnancy or conditions that have increased hormonal status.
The wide variety of symptoms often leaves patients without an accurate diagnosis for years. Caroline says her reddened cheeks and sensitivity to sunlight are common among her friends with lupus. So too are skin rashes, achy joints, anemia or low white blood cell counts, fevers and headaches. Dr. Chowdhury urges anyone with these persistent symptoms to see a rheumatologist because lupus may lead to other conditions like heart disease.
In fact, women in the 30 to 45 age group are at 50 times increased risk of having a heart attack compared to women of the similar age group.
Caroline's hope lies in research, knowing that the next breakthrough might be the one to free her from the anti-inflammatory steroids most patients depend on.
It's wonderful that the medication allows you to function and keeps you alive, but mood swings and insomnia and weight gain and severe hunger are significant side effects that are hard to live with.
For the Mayo Clinic News Network, I'm Dennis Doda.
You can see it has a lot of pieces.
When you're a passionate quilter like Sandy Huber, there's always lots to sew, lots to cut.
I couldn't do it anymore because my arm hurt.
Lots to miss out on when carpal tunnel syndrome strikes.
These fingers would always fall asleep. At night and in the morning, it would hurt a lot. 2 or 3 times a night, it would wake me up.
Sandy tried ice, a wrist brace, and cortisone shots. For many patients, such therapies bring relief, but for her, the ache and the numbness always return. So she joined the 500,000 Americans who have surgery each year to deal with this all-too-common complaint.
Carpal tunnel is the most common thing we see in patients coming to the hand clinic.
Mayo Clinic orthopedic surgeon Dr. Sanj Kakar says the problem lies in the palm of your hand, where a tight little band of tissue covers that important little tunnel.
It permits the travel of all the tendons, which are like the ropes that help you move your fingers in the hand, and also a nerve called the median nerve.
Dr. Kakar says pressure on that nerve may be caused by inflammation, masses, or a thickening of tissue, so the goal of surgery is to ease the discomfort by opening the tunnel and relieving the pressure.
So we would cut right here. Physically, what we're doing is we're releasing this structure called the transverse carpal ligament, which is the roof pressing on the nerve.
The procedure is done under local anesthesia. The patient goes home the same day. In the vast majority of cases, Dr. Kakar says the cause is not known, but some medical conditions increase your risk, such as diabetes, underactive thyroid, or rheumatoid arthritis.
And also those people who, for example, work in factories doing a lot of movement of the wrist into extreme positions of flexion and extension of the wrist for a long period of time, there's a link to carpal tunnel.
Well, this is a quilt I just finished.
Fortunately, there are also therapies that work.
I'm so happy that I did it. Now it's wonderful.
For the Mayo Clinic News Network, I'm Dennis Doda.
Hi Sam, my name is Mary. I'm one of the teachers here.
It's preschool screening day for 4-year-old Sam Rex.
So you've come to play my 4-year-old games.
This school district in Rochester, Minnesota, like many across the country, screens all 3 to 5-year-olds before they start school. They test things such as height, hearing,
Your ears work really well.
vision,
Sam, have you ever played peekaboo with your eyes before?
and other areas.
It's important to find out if your child is developing, the way they should be so that they're going to be ready for kindergarten.
And now they've added body mass index, or BMI, to that list.
1 in 3 children is either overweight or obese.
Mayo Clinic Dr. Esther Critch and colleagues developed the BMI screening material. They want to identify kids whose BMI is too high and educate parents.
So our goal is to try to stop the problem before it starts, and that's really prevention.
If a child is found to be overweight or obese, which little Sam is not, the school offers parents information supplied by Mayo Clinic that can help.
Teaching parents about how to keep their children active and how to make healthy choices about eating habits.
Habits that can improve the health of children not just during the school years, but for a lifetime.
High five. Nice work.
For Mayo Clinic News Network, I'm Vivian Williams.
This is Binks, or Mr. Binks as we call him. He's the guilty party.
Dawn Bothan loves her pets, Binks the cat and a 4-pound Pomeranian named Cooper, who seem pretty fond of each other because Binks tries to play bodyguard anytime visiting dogs get too rough with Cooper.
The other dog was just on top of him playing with him, and he was squeaking. So the cat got worried for the dog. I had my hand down there and the cat just struck.
The resulting wound looked like a vampire bite. Dawn says although it really hurt, she thought, oh well.
It'll heal. No big deal.
1 week later, the redness and swelling finally concerned her enough to see a doctor, who immediately sent her to the emergency department. What followed was a hospital stay, IV antibiotics, and a very close call.
I had 7 surgeries in that following 2 weeks while I was in the hospital. It was scary. I cried every night before surgery. Every night, because I had it in my head I was going to wake up at coming out of surgery with no arm.
The cat bite is the worst.
Dr. Annie Sadasti is the chair of Mayo Clinic's Department of Emergency Medicine.
By virtue of the puncture, the bacteria get closed in, and it's hard to wash out, no matter what we do.
That's why Dr. Sadasti says we should always seek care for animal bites. Wounds to hands and joints, or those with significant bleeding, numbness, or loss of function also need attention. For small cuts, the doctor says we can simply rinse them well with tap water and apply a triple antibiotic ointment. Antiseptics like alcohol or hydrogen peroxide are not recommended.
Some of those are extremely painful on an open wound, and you can actually damage some of the tissue through that.
If, after your best efforts, a skin injury shows increasing redness, swelling, or oozing, see a doctor.
But in general, the message is sooner rather than later.
Protecting Cooper from the great big nasty 4-month-old pit bull.
It's a lesson Dawn says she learned the hard way. For the Mayo Clinic News Network, I'm Dennis Doda.
That's all for this episode of Medical Edge. If you're interested in learning more about any of the stories featured on this program, you can find additional resources by visiting our website and following the link to the Mayo Clinic. Thanks for watching, and be sure to watch the next episode of Medical Edge from the City of Thornton.